Get the cart. Get back in here. Hello, I'm Dr. Shelby Edwards, and I'm a member of the Interprofessional Education Collaborative called IPEC here at UVille.
Hey, and I'm Dr. Hall. I'm the director of the Interprofessional Education Simulation Center here in the Health Professions Hub and the co-chair of the Interprofessional Education Collaborative.
Interprofessional education, as you know, is a pivotal part of all of our education here at UVille, and we have activities each semester for IPE.
All of the IPE activities take place in the hub. The Sim Center is designated as room 205 here, and we will ask you to look at the signs when you come to the Sim Center so you know how and where to check in.
Keep in mind, participation is mandatory, and it may be tied to a grade or professional developments in your course. Sign up is arranged by your course faculty. Please show up 10 to 15 minutes before your session is scheduled to begin. You must show up at your designated session. There is no guarantee that you will be able or offered a makeup session if you miss yours or don't show up to your session. Sessions are carefully constructed to include you. If you're missing it, it affects the entire session. Please contact your faculty if you have an emergency or you need to change your sign-up date.
So behind us, you see the Simulation Center back there. We are standing in the hub, the Health Professions Hub, in what we call the IPESC. Once you check in, follow the signs to know where your session will be. You and your faculty facilitators or observers will leave all of your belongings outside the debriefing room. No drinks, no food, no cell phones are permitted in the debriefing rooms. Cell phones are to be off on airplane mode and silenced. It's typical for cell phones to be not used in a simulation center because we're a Wi-Fi environment. Your signals from your phone can interrupt some of the education. Thank you for your compliance. Of note, please also resist the urge to purchase a drink or food before coming to your IPE session. You will not be able to enjoy that drink or your food until the full session is ended. We want to demonstrate for you how we would like you to check in. When you come into the Simulation Center, you will take a picture of a QR code that registers you for the night. Then you'll make out a name tag, putting your name and your department or program on there. These name tags help the actors and all the participants know what program you're working on. And you're going to walk over to the table outside the debriefing room where you'll see a sign that says, please place all your belongings here. And you see Dr. Edwards turning off her phone, leaving her drink, leaving her belongings, and walking into the room.
For the Chris Dulles scenario in the spring, sessions are 4 hours and you'll be with an interprofessional group of about 8 to 15 students from other programs. Simulations have 4 parts and we will meet as a group to talk about what happened with everybody after each part. Each of you will have a role to play and you'll get to interact both with other members of the team as well as the patient. Those who are in the debriefing room will watch a live video feed of the action while it's happening in real time.
So don't be alarmed that you'll be asked to do anything outside of your scope of knowledge. You will be given a prompt card with the role you are asked to play, and it has directions for you on what you're expected to do. Faculty will be there to help you and direct you to go wherever you need to go.
Don't worry, we'll tell you what you need to do. Okay, some very important caveats. All of the programs on campus must participate in IPE in order to maintain their accreditation. It's that important. There are copious data showing that IPE improves team communication, makes patient care safer, and keeps healthcare costs down. It's truly an extremely important part of all of our education and our clinical practice. The data were so compelling in clinical practice settings that mandates to introduce IPE during training were implemented in nearly all professions in the last decade.
So in addition, the IPAS, where I work, is evaluated on key performance indicators. Some of those indicators are numbers of students per program, and just participation in IPE activities.
During simulation sessions, you are not graded. You are not assessed on your performance or your knowledge base or what you do, or maybe what you didn't do correctly. We're all just here to learn from each other and about each other. That's the spirit of IPE. And remember, what happens in simulation stays in simulation. Don't talk about the experience with your classmates. We hope this helps you know a little bit about what to expect with IPE.
We hope you enjoy your time.
And learn something interesting about other professions.
Or maybe your own.
Please talk to faculty if you have any further questions.
And we are done with our presentation.
Almost.
Oh,
Almost.
Oh, what do we have?
Almost. We have a couple of key points that please remember when you're attending simulation. Go ahead.
Oh, arrive 10 to 15 minutes early.
There's electronic check-in, and don't forget to make a name tag.
Leave all your bags, food, drinks, cell phones outside the debriefing room.
You do not need any devices, books, or anything with you.
Turn your cell phone off.
Leave your name tag when you're exiting the simulation center, please.
You must show up at your assigned session and participate.
And what happens in simulation stays in simulation.
Thank you.
Thank you all. You would get better.